All right.
This is a unique virus in that it is truly, in an unprecedented way, killing people, young people, older people. We're seeing high infectivity, transmission rates that we've never seen before. I think that I've never felt so physically and emotionally burdened in my life. I've never felt so deeply sad and distraught. I think about all of my patients. I don't care about their age, their race. I don't care about how they sort of got there, but I feel incredibly sad because so many patients die without having someone by their side. We have strict visitor requirements, so often a patient will be on their deathbed dying alone, and it's been incredibly painful to see the suffering of family members who I call from the ICU, hearing their tears, crying with them on the phone, and telling them that if and when we're able to extubate some of these patients, I will try my best to have them FaceTime. They have less access because they're not making it to the doors of the hospital the same way insured people are and white people are in the city. We often close the door to this group of people even before COVID. So now when COVID is acting upon an already segregated system, we are neglecting this population of people, and I'm calling upon all of us, elected officials, healthcare leaders, to make sure that this group of people are not left outside. The worst case scenario is a very realistic picture if we keep going down the road, which is a hospital that is now resource poor, where healthcare professionals are sick, where unfortunately patients, both mildly sick and those that are dying, are coming in, overwhelming the resources, and we have to make decisions about who we can help. We are basically told to use a mass for an entire week so that we can conserve supply. We are told that we should make sure that we keep that mass intact. But this is a serious crisis that we're in, and we deserve to be protected. We're not in a battlefield. We're not in a war zone. Could potentially get to a point where there has to be a rationing of ventilators. At the rate that this virus is exponentially transmitting, our transmission at this stage, I go home every single night and think about what if we had to decide between two patients.